Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Today we'll be talking about botched gynecomastia surgery, or commonly mentioned as gyno surgery. Can a gyno surgery go wrong? Yes, it can. It is not as simple as doing a gynecomastia surgery or removing the enlarged glands or treating your condition. I think for a patient coming in to see us, when they come in, what they are concerned is how their gynecomastia, how the enlarged breast affects how they see themselves, how they look, how it affects them in their self-confidence and everything. So patient coming in seeking for surgery actually is about how to make them look better, improve, natural, so that they can do, they can feel and act normally. So to me, gynecomastia surgery involves not only removing your glands, but also improving the aesthetics of the chest and breast and hopefully make it look better than before. How does a botched gyno surgery looks like? It could look like anything. A gyno surgery can go wrong if the glands is incompletely removed or improperly removed, leaving behind scars, dent, leftover breast tissue, causing uneven appearances. And also, it could be due to inadequate removal of the surrounding tissue, fat tissue, and causing uneven appearance, loose skin, and even worse, unnatural, asymmetrical look. So it involves not only treating and removing the glands, but to try to reconstruct a natural aesthetics surrounding the breast tissue and the chest. What does botched gyno surgery look like? Patients with botched gyno surgery may have irregular dents, thickened scars, depressions, unevenness, loose skin, may even have residual glands from the previous surgery. It will make them look unnatural, looking worse than before. Therefore, patients with botched gyno surgery usually feel more miserable, depressed, and unhappy compared to what they felt before the surgery. I remember a patient that I saw a while ago with gynecomastia. He had surgery done about 10 years ago. After the surgery, he still felt that his condition did not improve. In fact, to him, it got worse. He has some scars, uneven skin tone, asymmetrical shape, and it affected him a lot. He felt guilty. He thought that the surgery could improve and correct his symptoms, but in fact, he felt worse after that, and he blamed himself for doing the surgery. So when I saw him, and I told him that this condition can be improved, and subsequently he had correction done, and he felt happy about it after that. And when I saw him again, he is much happier, more confident, and according to him, he could go swimming again, he could wear clothes he couldn't do before, and so on and so forth. How can a botched gyno surgery be corrected? Well, it depends on the cause of it. If it is due to thickened irregular scar, then scar revision will be helpful. If the patient had irregular, uneven dents, then sometimes fat grafting can be useful. However, if it is due to some leftover glands, leftover fat tissues, then a corrective surgery involving liposuction, removal of the residual glands may be required. So it really depends on patient's condition and how severe it is. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them.